All right, so this is removable partial dentures review series number 2. So if you haven't reviewed the number 1 video, please after you watch this one, go back and review the first series. Okay. All right, so let's move on. So question number 6. So last series we stop at question number 6. We're going to start today on question number 7. All right. So question 7, a removable partial denture component that resists cervical displacement of RPD and prevents extrusion of an abutment tooth is what? So which component of a removable partial denture prevents extrusion of an abutment tooth? Okay. So is it a rest seat, B, a major connector, C, a palatal strap, or D, or the above? Okay, so the answer is A, rest seat. So a rest seat prevents, okay, extrusion of the abutment tooth. All right. So let's review the function of a rest seat. So what are the functions of the rest seat? Okay, so the rest seat transfers occlusal forces to abutment teeth, providing vertical support. And also, it maintains direct retainer in its position. So a rest seat is an indirect retainer. Okay, it helps to maintain a direct retainer in the position. Okay, and it prevents cervical dislodgement of an RPD. It also provides a reference point of relationship between hard and soft tissue. A rest seat also prevents tooth movement, such as extrusion, migration, or rotation. It can function as an indirect retainer. Keep that in mind. A rest seat can function as an indirect retainer. Okay? So, usually the primary purpose of the rest seat is to provide vertical support for the partial denture. And in doing so, it also does maintain components of the RPD in their planned position, maintains established occlusal relationship by preventing settling of dentures, and also prevents the impingement of the denture of soft tissues. Okay, and as we saw in this question, the rest seat directs and distributes occlusal loads to abutment teeth. Okay, so you have to know the function of rest seats. All right. So, question number 8. Which maxillary merger connector is indicated for a short span tooth supported RPD? So, a short span tooth supported RPD, which one is indicated, right? So, for example, you're missing one tooth and you're going to put, 1 to 2 teeth, and you're going to put a major connector in the maxilla. So, which major connector would you use? Would you use a horseshoe? Would you use a palatal strap? Or would you use a full palatal plate? Or none of the above? Okay, so our answer is B. So for a short span tooth supported RPD, a palatal strap is very good for that. Okay, so you have to know. Okay, you have to know that the maxillary major connectors, they are indications. All right, so a single palatal strap major connector is better suited for restorations of a short span tooth supported bilateral edentulous areas. So if it's a short span tooth supported bilateral edentulous area, and then you can choose a palatal strap. Okay. Also, a palatal strap may also be used in tooth supported unilateral edentulous situations. All right. So make sure you know the functions. However, the width of the palatal strap should be confined within the boundaries of the supporting rests. So don't extend it beyond the width of the missing teeth that you are replacing. Okay? So make sure you understand that. And it has to be rigid. So for in order for the palatal strap to be rigid enough to resist torque and to provide adequate vertical support and the horizontal stabilization, it has to be bulky. So that's the problem with the palatal straps. Palatal straps tend to be bulky. All right, and if it's bulky, it prevents with the patient's speech. Okay, so make sure you understand that. Because it's bulky, it may interfere with patient speech. Okay, all right. Question number 9. In occlusal principles. So this question is supposed to understand really well. Okay, so in occlusal principles and setting of posterior occlusion, which of the above component of the equation is outside of the control of the dentist? Okay, so this equation you're supposed to know when you're setting up denture teeth. Okay, CG stands for condylar guidance. IG stands for incisor guidance. So CG plus IG equals the PO, which is plane of occlusion, plus compensating curve, plus clasp angulation or clasp height. Okay. So which of these 5 components of ideal occlusion would you does is not able to be changed by a dentist? Okay, so which one can you not change? Can you change condylar guidance? Can you change incisor guidance? Right? Can you change the plane of occlusion, or can you change the compensating curve or cuspal angulation? All right, so this one you cannot change. The dentist cannot change the condylar guidance. Okay, so our answer here is C. Condylar guidance cannot be changed, and you're supposed to understand that. Okay, so here, and this principle, you're supposed to understand this principle, occlusal principles setting of posterior teeth by Hanau's Quint equation. Okay, Hanau was a dentist. Okay, and he came up with this principle of an ideal occlusal determinants. Okay, so 5 determinants that affect occlusal balance. You have the condylar guidance, incisor guidance, and on the other side you have cuspal angulation, compensating curve, and so the plane of occlusion you can change. The compensating curve you can also change, and the cuspal angulation you can change. Incisor guidance you can change, however you cannot change the condylar guidance. Okay, so the only factor not under the dentist's control, the only factor that cannot be changed by the dentist is the condylar guidance. Okay, So to keep a balanced occlusion, if the clasp angle was increased, so if you increase the clasp angle, okay, if the clasp angle increases, it means all these other components, all these other remaining four components have to be in balance, okay? So if you increase the clasp angle, then either the plane of occlusion is going to be decreased. So you can either decrease the plane of occlusion in order to keep it balanced, or you can decrease the compensating curve. Okay? So make sure you understand that. Or instead of, if the cusp angle increases, instead of decreasing these two, you can increase the incisor guidance. Okay, so make sure you understand this equation really well. Okay, so make sure you understand that. And so the compensating curve, remember, you have to understand the Christensen's phenomenon, where the posterior occlusion in anterior and posterior and lateral dimension compensate for by separation of posterior teeth. Okay, so make sure you understand this equation really well. Okay, all right. So question number 10. Which of the following is true about retentive clasps? Okay, remember there's retentive clasps and there's reciprocal clasps of an RPD. So you have to know about those. So which of the following is true about retentive clasps? A. CACC clasps are most often used with 2.2-inch retention. B. Combination clasp. A combination clasp is also a wrought wire, is most used with 0.01-inch retention. C. Clasp clasp. Clasp clasp is most used with 0.01 millimeter retention. D. Combination clasp is most used with 0.02-inch retention. Okay, the answer is D. You have to make sure you know that the dimensions and indications of a wrought wire, which is also the combination clasp. Okay, so you have to know that the clasp clasps are most used with 0.01 inches. So make sure you also know the dimensions, the units that they like to use. Okay, it's not millimeters, it's not centimeters, it's in inches. So you have to make sure you know that. Okay, and a wrought wire clasp, okay, or combination clasp is usually used with 0.02-inch wide. Okay, retention. So the retention, you have to know that it has to be at least 0.02 inches. Okay, so when you're using your surveying table and you're getting your survey lines, if you're planning to use the wrought wire, then it has to be a 0.02-inch retention. Okay, all right. Question 11. Which component of a removable partial denture prevents major connector from tissue impingement? So we saw this already, okay? We saw this when we were discussing a rest seat. However, in these options, we don't have the rest seat. So you have to know how the rest seat functions, okay? So this is a good question to show that you understand the components of the RPD. So which component of an RPD prevents the major connector from tissue impingement? A. Beading line. B. Fulcrum line. C. Indirect retainer. D. Posterior palatal seal. So our answer is indirect retainer. Okay. So our answer is C. Remember, A rest seat, as we saw previously, acts as indirect retainer. Okay? All right. So let's review indirect retainers. So indirect retainer is used primarily in Kennedy class 1. Okay? You have to understand the Kennedy classification. These are easy points on the exams. Okay? Kennedy class 1, 2, 3, 4. All right? Kennedy class 1 with modifications. So you have to understand that. So an indirect retainer is used primarily in Kennedy class 1, 2, and extended class 4. Indirect retainer consists of rest seat and a minor connector. All right? Make sure you understand that at this point. Indirect retainer acts to stabilize RPD distal extension indirectly when the patient eats sticky foods. Okay? And usually indirect retainer is placed far away from the fulcrum line. Another key point that you need to understand. So if you place a rest seat, which is an indirect retainer, it has to be away from the fulcrum line. Indirect retainer prevents major connector from tissue impingement. They offer a third point of reference for frame seating and allows accurate positioning during reline or rebasing. Okay, so because you know where your rest seats are, so which are indirect retainers, so those can help you reposition uh, the the RPD when you are relining or rebasing. Okay, and the key points to remember. Okay, always indirect retainer always required on a distal extension. All right, and it is always placed away from the fulcrum line. Okay, and you have to remember that rest seats and minor connectors are examples of indirect retainers. Okay, so this is we almost went over to 20 minutes. Just I want to keep them short, okay, so that you are not overwhelmed with the information. So coming up next is going to be removal partial denture review series number 3. So make sure you click subscribe and don't forget to click the bell for notifications so that when I post the upcoming lectures, you can receive the notifications. Okay. All right. Good luck and keep sending those questions that and the suggestions. Okay.